Hey, give me one. Oh shit! Give me one, man. Give me one. I'm singing by too. Take it. Just leave me alone, don't shoot. Fight, man. Oh, sweet Jesus! Help! Help! Oh man.
Are you alright, sir?
Help, please, man.
Oh, dude.
Oh man, it hurts
Hey,
so
hey,
much.
hey, 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 hey. Look here, look here,
Yeah,
look
man.
here.
Yeah.
One word.
What is it, man?
Karma.
What?
Now marking up the patient, getting him ready for surgery. Make sure we know where the clavicle is. Scapula is around here. Head of the humerus right here. Alright. Appears that there's some damage to the acromioclavicular ligaments right here. And the glenohumeral ligaments right here. Alright, soon we're gonna have to reattach these ligaments together with some Kerscher wire eventually. Hopefully that stabilizes the scapula. Eventually the clavicle. And from up here, the acromion process, we're going to do an osteomy where we cut off the top of the acromion process, stretch it out right over here, get a clamp right between here where this marking is, and from there connect the clavicle with the scapula right here. And once we get that clamp there, we're going to stretch the ligament and attach to the scapula right here, which should stabilize these two bones right here. And after we do that, we'll just make sure the Kerscher wire stays in there, get the humeral head into the glenoid cavity, lock that clamp in, the screw right here, and he should be very mobile, but he's going to have to be careful going back into it, such as whatever he's been doing. It says here, bike case, I don't know.
I'm sending Snapchat to all my people, man. In surgery, just got out. Thug life, YOLO.
Hello, my name's Dr. Phil.
Hey, Dr.
How you
Phil.
been? I
I'm
was
fine.
one of the many doctors that operated on you yesterday. I realized your injury was very severe, a type 3, that required immediate surgery, or else what would have happened was we wouldn't be able to save your arm. There would be permanent damage in your nerves right here.
Wow, so since because of that, what happened to me, Doc?
Well, first of all, what happened to you?
See, I was riding my new bike and I happened to have fallen off of it.
Ah, I see. Well, what happened when you fell off your bike, you separated and dislocated your shoulder, which is the loosest joint in your body. Causes a great rotation in the arm, at least 360 degrees. You know, get the idea.
Yeah.
Since our hands are pretty handy, we tend to pull and push a lot, right?
Yeah.
You get me? But what was happening when you fell, your acromioclavicular and glenohumeral joint was applied an excessive amount of force that caused your humeral head to get out of this glenoid cavity,
Yeah.
the ball socket, right?
So, I hate to say this, but in English, please, Doc.
Well, what happened was your arm bone fell out of your shoulder joint.
Yeah.
That's what happened.
Oh, okay. Now that's more simple for me.
That's more simple
Yeah.
for it.
Yeah.
And when that happened, you outstretched two ligaments that connect these bones together,
Yeah.
causing very instability. Well, let me ask you this. Did he fall with your arm out?
Yeah, pretty much something similar to that with my arm out, trying to break my fall.
Ah, I see. That's what I thought. When I saw your injury in the ER, this force you experienced when you fell off your bike caused all your body weight to go into your shoulder joint,
Yeah.
right?
Yeah.
Cause instability around the joint, and then your arm, your humeral bone, right, your humerus, fell out of the socket.
Yeah.
And then you damaged these two ligaments, which we operated yesterday.
Yeah.
Right?
Yeah.
Connects the scapula right here. Oh, I'm sorry. I'm sorry.
That's okay.
And I'm gonna hate to say this, but a lot of your muscles that are on the scapula are pretty weak right now.
Yeah.
So we're gonna have to get some. I'll explain the exercise later, but
Yeah, for an accident, it sounds like a lot of damage has happened to me just for an accident.
well, yeah, an unusual one at most. You
Yeah.
see, this usually happens to football players and rugby players,
Yeah.
and sometimes competitive cycling, like a lot of physical sports such as wrestling. You get me?
Yeah. Guess I'm a lucky one, right?
Yeah, very unlucky.
Yeah.
How did you feel when you fell?
See, at first when I felt shame, embarrassment.
Like, did
And-
you feel
and
like
hurt and pride.
numb, tingling, or pinching pain at all?
Oh yeah, I felt that too. After that.
Ah, that explains it. It is an
Yeah.
acute pain, you see. Can you please move your arm away from your body?
I'll try my best, Doc. Let's see what I can do.
Abducted.
No,
yeah, that's
see,
not good.
that's where it's starting to hurt now.
Alright,
Yeah.
alright. Can you bring it close to your body, like abduct it?
No, same thing as well, same thing as well.
Alright. Well, what happened, Ben, was there was a lot of inflammation and bruising on your shoulder,
Yeah.
right? Which is giving your arm a tough time to move, you
Yeah.
know? A lot of limiting your mobility.
Yeah.
And also your deltoid muscle here, which really helps you move your arm away from your body.
Yeah.
It's weak right now. It's torn up. And the supporting muscles around the scapula, which is your shoulder blade, right,
Yeah.
are pretty much weak.
Wow.
But for instance, here, let me show you right here. Where did I put those x-rays? Ah, here they are. See? Right here. The bone's right there, all falling off.
Yeah.
Another one right here.
Wow.
I know, it's amazing.
Looking at it now.
Yep. So, well, Ben, you wouldn't happen to play golf.
Well, I always find it interesting, but I have never played it.
Well, I'll be right back for a second. I think I have a good explanation of how to explain your injury right now.
Alright,
Be right back.
I'll be right
Okay?
here. I'll be right here.
Don't worry. Alright, I'm back, Ben, with a
Alright.
tee and a golf ball.
Alright.
Alright?
Yeah.
You see, let's say it is your scapula, or your glenoid cavity right here,
Yeah.
with the scapula. And this is the head of your humerus, which is the upper part of your arm bone right here,
Yeah.
right?
See that right there.
And what happened was, when you fell, the humeral head got stretched beyond its limits, ligament right here,
Yeah.
connecting the humeral head
Yeah.
to the scapula glenoid cavity. It
Yeah,
just
that's-
extended right here and really got out there.
Yeah.
And two of the processes here, well, it's pretty much two bones sticking out,
Yeah.
where the ligament connects, got overstretched, right? And when it got overstretched, dude, it fell off of the
Wow.
glenoid cavity. And then from that, when it fell off, the clavicle and the scapula, it got depressed and went down.
Wow, so it's depressed then?
No, not exactly, but it's below,
Yeah.
not where it's,
It's
up.
feeling, it's feeling down, in other words.
Yes. Do you want a
Wow.
Happy Meal with that?
Good one, Doc. Alright, so it's really funny how it's similar to a golf ball and a puck. I guess we got a little bit of Tiger Woods in this all the time.
Tiger Woods and us, yes. Well, let me just describe you some ibuprofen to reduce the swelling and inflammation.
Yeah.
What it's going to do, it's going to thin your blood so it doesn't clot up around here and
Yeah.
gets a good ball, right?
Yeah.
And you're going to feel some discomfort for a bit, so we're going to prescribe you some Coodine,
Yeah.
a type of painkillers, which will block out the sensory nerves right here
Now the
and
party's
cause you to
starting.
feel really good.
Yeah, now the party is gonna start.
Yes. Oh God, I don't know what my intern did. You could have this drawing. I don't know what she was thinking.
Well, your intern's pretty awesome.
All
Yeah,
right.
even though for all that happened to me, I don't remember that day right now.
All right. I'll be right back with you. I need to get the book on the rehab exercise we need to get you.
Alright, I'll just study this imagery.
All right, Ben. I'm back now.
man.
Along with your medications, I'm gonna have to ask you to do this. Shoulder rehab 101.
Awesome, man.
Alright, what you're gonna have to do when your arm's starting to feel a little better, when you get
Yeah.
that sling off, I want you to extend your arm like you're reaching for something, right?
Yeah,
And then I want you to bend your elbow right here.
yeah.
And when you feel ready, you're gonna touch the back of your opposite shoulder right here.
Yeah.
Right?
Alright.
And once you're done with that, you're gonna extend your arm right here, like you're holding a soup. Move it up, down, soup, pro, and then move your arm like this.
You're waving to someone, right? Like if you're waving to someone?
Like you're waving to someone, like hailing a taxi.
Oh, okay.
So here's this book to help you out.
Alright.
And you can have this drawing for free.
Alright.
Alright, and
Alright, so I guess we're done for today, right?
yes, your checkup's done for you today.
Alright. So
Alright.
I guess that's it then.
Yes, that's it. Oh, one more thing. You need some precautions before you get back out there and start riding your bike again.
That's true, that's true.
First, I want you to watch where you're going, because that's what I think happened when you fell.
Yeah.
Right? No rocks, not rough terrain.
Yeah.
And if you have laborious works that demands a lot of pushing boxes and whatnot, don't get back on that. It would take at least a good month off, let that recover.
Yeah, I guess I gotta get vacation time then.
And vacation time,
Yeah.
workers relief, paid vacation, whatever you gotta do.
Yeah.
So just keep an eye on that and come back for a checkup in 2 weeks. We'll see how it's going and continue your rehab exercise.
Alright.
No.
Thanks, stuff.
You're welcome.
Let me see. Can't hold it real fast, I'll give you a handshake, man.
Okay. Alright.
And this is gonna suck.
We gotta do this periodically, like rub it down.
Yo, what's up, MTV? Wait, who was that guy's name? I am Nick Swatson, man.
Alright.
And now,
Alright, so I got my book, Shoulder Rehab 101.
awesome.
Number 2. Alright, what you're gonna have to do is, you're gonna have to... Fuck, I don't know what to do.
Stop.